Hey, it's Mr. Shrum, and I am back again with a lesson walkthrough tutorial of the endocrine system. So we're going to take a look at that right now. There are several glands in the body, and we can classify those into two types based on their structure and how they function in the body. And those two classes or classifications are the exocrine glands, as you can see here, and endocrine glands. And so what's the difference? Exocrine glands produce secretions that are transported through ducts to their destination. Examples of these types of glands are sweat glands, salivary glands, so saliva in your mouth, and mucus glands. So think of exocrine and ducts. And on the other hand, endocrine systems are ductless. So there are no ducts. And these secrete specific chemicals called hormones directly into the bloodstream. The blood transports these hormones to specific sites where they cause the desired responses. So just be careful and to keep those separate in your head. So you can know that exocrine glands have ducts and endocrine glands are ductless and they secrete hormones into the bloodstream. Think of endocrine as into the bloodstream. Now, the endocrine system as a whole functions very closely with the nervous system as they both regulate and integrate body processes. The nervous system is rapid, but usually the effects are short-lived, whereas the endocrine system is slow, but has longer lasting effects. So the nervous system is quick and the changes will be short-lived, and that is generally not the case in endocrine systems. The two systems are also related because of their link with hormones. The hormones released from the endocrine system can cause changes in the nervous system. The nervous system can stimulate or inhibit the release of hormones. The endocrine system is composed of these principal endocrine glands: the pituitary gland, the thyroid, the parathyroid, the pancreas, the adrenal glands, gonads, pineal gland, and thymus. And you can see those here in this photo. The pituitary gland is a very small pea-shaped gland located on the inferior aspect of the brain. So here we have it right there. And it secretes 9 important hormones. We have the growth hormone, or GH. That regulates the rate of growth of all body cells and promotes cell division. We have follicle stimulate hormone, or FSH, and that hormone stimulates the testes to produce sperm or the ovaries to release eggs. Then there's prolactin that stimulates the production of milk by the mammary glands in females after birth. And then we have oxytocin that causes uterine contractions during labor and the milk to let down in the mammary glands. Moving on. Then we have the thyroid gland. That is the largest endocrine gland, and it's located right below the larynx. And the thyroid releases several hormones. We have thyroxine, or T4, and triiodothyronine, or T3. And those increase metabolic rate, or how quickly you are actually burning calories. And then we have calcitonin, and that stimulates bone growth. So think of calcium, calcitonin related to bone growth. Then we have the parathyroid glands. They are small, flattened glands embedded in the posterior surface of the thyroid gland. There are usually 4 parathyroid glands, and they all secrete parathyroid hormone, or PTH. And that hormone stimulates the breaking down of bone. Then we have the pancreas. It's a soft, almost pistol-like shaped organ, and it's located posterior to the stomach and level with the top of the small intestines. It's both an exocrine and endocrine glands. And the exocrine function, the pancreas secretes pancreatic juice through the pancreatic duct into the duodenum. While the endocrine function is a cluster of cells known as the islets of Langerhans, and it secretes insulin and glucagon into the bloodstream, and that controls your blood sugar levels. You can see that the endocrine and the exocrine in this image. We also have the adrenal glands, or adrenal glands. That's the proper way to pronounce that. These glands are paired organs that cap the superior borders of the kidneys. These glands are composed of an outer cortex and an inner medulla, which function as separate glands. The adrenal cortex produces over 30 hormones. These hormones are called corticosteroids, or corticoids for short. The adrenal medulla secretes 2 closely related hormones called epinephrine and norepinephrine. These hormones prepare the body for greater physical performance during the fight or flight response. So anytime you've heard someone say something along the lines of my adrenaline was going, fight or flight, I was anxious, or some type of stress in the body, this is what is happening. The gonads are the primary sex organs, like we've talked about before. In the male, those are the testes. Females have ovaries. The testes produce the male sex hormone, testosterone, while the ovaries produce the female sex hormones, estrogen and progesterone. The pineal gland is another small pine cone shaped gland located within the brain, and it secretes a hormone called melatonin. Melatonin controls your sleep cycle. So when you're tired in bed, this is the gland working away, trying to get your body to stay asleep. And the thymus is located in the mediastinum, behind the manubrium of the sternum. So right about here. It secretes hormones that are associated with immunity. And altogether, this system secretes hormones directly into the bloodstream. Principal endocrine glands include pituitary gland, thyroid gland, parathyroid gland, pancreas, adrenal glands, gonads, pineal gland, and the thymus. And that's it for the endocrine overview. Let's hide these controls, and I can move on to the endocrine system issues. So what can go wrong? What's possibly what can not work in the endocrine system? Well, issues associated with the endocrine system are caused by abnormal levels of hormones produced by the endocrine glands. So we're going to look at three disorders: acromegaly, goiter, and Addisons disease. Acromegaly is a disorder of the pituitary gland, and this occurs when the pituitary gland secretes too much growth hormone. So you're getting too much GH. And when this occurs in children, it is known as gigantism. Abnormally high levels of growth hormone promote bone growth in the hands, feet, and face regions. The changes occur so slowly that it is often hard to recognize symptoms. Individuals will begin to notice that his or her shoe size has increased, or that a ring she wears or used to wear no longer fits. If left untreated, acromegaly can lead to serious complications and can even be life-threatening. So what are the symptoms to look out for? Well, like we said, enlarged feet and hands, enlarged facial features, excessive body odor, fatigue and muscle weakness, a deepened voice, headaches, and impaired vision. What are some of the risk factors? Well, most often this affects middle-aged adults. There are no known or other known risk factors besides that. How does one treat acromegaly? It's often caused by a non-cancerous pituitary gland tumor. The tumor can increase production of the growth hormone, which results in acromegaly. Therefore, in order to treat this in an individual, they may have to undergo surgery to remove the tumor altogether, or radiation to kill the tumor cells. Treatment may also include medication to decrease the production of the growth hormone or to block the effects of the growth hormone. Prevention. Researchers are still working to determine ways to prevent pituitary gland tumors altogether, as well as acromegaly. The next issue that can develop is a goiter, and that is an abnormal enlargement of the thyroid gland. The thyroid gland is already the largest endocrine gland, and it's located just below the larynx. And a goiter may be caused by an over or underproduction of thyroid hormones. This is the most common cause of goiters in the United States. Worldwide, the most common cause is due to a dietary lack of iodine. However, in the US, iodized salt is regularly consumed. So what are some of the symptoms to look out for? Well, if there's swelling at the base of your neck, near where your Adam's apple would be, difficulty swallowing or breathing, a tight feeling in your throat, coughing, or hoarseness. What are some of the risk factors? Well, goiters can occur at any age, but they are more common after 40 years old. Other risk factors that result in a higher risk include being female, because women are more prone to goiters and other thyroid disorders for some reason, individuals who don't have access to iodine, individuals who take certain immunosuppressants, anti retrovirals, and specific heart drug medications. So if your body's already dealing with something else, or you're taking medication that can suppress your immune system, you may be more susceptible to goiters. Well, how do you treat goiters altogether? They're usually painless, and so if the goiter is small, the doctor may recommend waiting and watching for changes. If it's large and is making it difficult to breathe, the doctor may recommend surgery to remove part or all of the thyroid gland, and that's called thyroidectomy. Prevention. Um, One of the only known ways to prevent goiters is to eat iodized salt. If your iodine levels are checked, then that should be enough prevention for most people. Addison's disease is our last issue today, and that's a disorder of the adrenal glands. It's caused by an inadequate secretion of specific hormones produced by the adrenal cortex. If left untreated, Addison's disease can be life-threatening. Symptoms of this disease include low blood sugar, dehydration, rapid weight loss, generalized weakness and fatigue, darkening of the skin, muscle and joint pain. What are some of the risk factors? Well, it can occur in both males and females as well as any age group. Currently, there are no known risk factors. Well, what about treatment? Addison's disease is treated by hormone replacement therapy. Individuals will receive medication or injections to restore the levels of the missing hormones. Sometimes a serious complication of Addison's disease will occur, known as Addisonian crisis. This occurs if the individual experiences low blood pressure. Low blood pressure levels, or low blood levels of sugar and high blood levels of potassium simultaneously. So if an individual has low blood pressure, low blood sugar, and high blood levels of potassium all at once, that would require immediate medical attention, or else the individual could actually die. To treat an Addisonian crisis, the individual will be given an intravenous injection of hydrocortisone, saline solution, and sugar. Addison's disease, prevention. Researchers are still learning more ways to help prevent Addison's disease. And altogether, issues associated with endocrine system are caused by abnormal levels of hormones produced by the endocrine glands. Examples of the endocrine disorders and associated glands include acromegaly, that dealt with the pituitary gland, goiters, that dealt with the thyroid gland, and Addison's disease, which dealt with the adrenal glands. And that's it for the endocrine system and the issues associated with the endocrine system. If you have any more questions, don't be afraid to ask me. Send me a message in Canvas and we can schedule some type of Zoom. But that's it for today, and I will see you all next time. All right, bye-bye.